another episode and the new season of HealthWise for 2026. I am your host for tonight, Monique Lescott, in collaboration with the St. Kitts Nevis Medical and Dental Association. And as I said, a very warm welcome again and good evening again, everyone out there listening and tuning in to our show from YouTube, TV, and I'm not sure we're on Radio Land, but welcome. I'm going to be your host for tonight. Originally, I was going to have a guest, Dr. Jonathan Carty, but because of circumstances beyond both of our control, he was not able to make it tonight, but I'll try my best with just me alone, and I hope you guys are able to follow and enjoy the material as well. So I'll jump right into it. Our topic for this evening, we're going to be looking at types of respiratory illnesses and how each can be treated, because this is the flu season and I just thought it would be a timely topic for the time being, because we have so many persons that have I don't want to say fell victim or have fallen victim to the flu, but so many persons have contracted the flu virus, and I just wanted to cover the topic so that we can, everyone can learn together things that we might not have known already. So I'm going to jump straight into our slides. Can we have our first slide? So the differential diagnosis for respiratory illnesses. Like I said, this is the flu season, and most persons, for some reason, I've gotten many persons coming to me asking me, well, how do I go about dealing with the flu? Some persons have requested antibiotics for the flu, which for my taste and purposes, I don't think an antibiotic should be given really for the flu, but some medical practitioners do it, and with good results. But if it's truly the influenza virus, it's a viral illness and should be treated with antivirals such as Tamiflu, which is an antiviral, instead of antibiotics. So the differential diagnosis for respiratory illnesses include a wide range of conditions, from the common cold, infections to serious diseases, and is essential for effective treatment in order for persons to be healed or to move on from whatever symptoms they're experiencing. Can I have the next slide? Some common respiratory illnesses that we see around this time affects the upper and lower respiratory system. That's how we, as medical persons, we split, so to speak, for treatment purposes. There's a big difference between upper respiratory illnesses and lower respiratory illnesses. The upper respiratory really is the nasal cavity, the larynx, the pharynx, the oral cavity. What we call lower respiratory tract infection is when we have the trachea, the bronchia, and the bronchioles, and etc. There's another slide presentation at the bottom that basically shows, yes, this is it, the difference between the upper and lower respiratory tract and how we try to class different illnesses based on where in the respiratory tract the issues is occurring. So the common respiratory conditions of the upper respiratory tract infections include most common acute illnesses, such as the common cold, the flu, as I just mentioned, sinusitis, pharyngitis. Symptoms typically include cough, sore throat, and nasal congestions. Typically, I'm a very thorough type of investigator when it comes to these things. For me personally, I would prefer if most medical practitioners could use like sputum tests and different diagnostic tools to determine whether it's a viral issue or a bacterial issue, but sometimes that's not always possible. And so if it's a suspected bacterial issue, they would probably prescribe a broad spectrum antibiotic that is able to cover most of the bacterial infections that we see. I personally would prefer for proper investigations to be done to determine whether it's viral or bacterial, though, because I'm concerned about bacterial resistance becoming on the rise and being an issue for medical practitioners on a whole. So the next slide now, I'm moving on to the influenza virus. I don't think many persons realize that the flu virus has many variations, but they're actually typically broken down or categorized into 3 types. There's type A, influenza type A, influenza type B, type C. There's also a type D, but that apparently is animal related. So I did not include that in the presentation. It's another slide further down with the illustration of the different, So that's why it's, for me, there's a big difference between the flu and the common cold and other respiratory issues. The flu, it's a virus, it's a viral issue, and so should be treated as such. The influenza, commonly called the flu, is an acute viral infection of the upper and lower respiratory tract. Can I have the other slide? Is an acute viral infection of the upper and lower respiratory tract, including the nose, throat, and lungs. It is caused by RNA viruses in the orthomyoxyviridae family, for the long verbiage, categorized into 4 types. Like I said, it's A, B, C, and the D type. Types A and B are responsible for seasonal epidemics, with the type A virus further divided into subtypes based on the hemagglutinin and the H neuraminidase surface proteins, such as the H1N1. I think everybody would have remembered when the swine flu was a whole issue. And so you had the H1N1 and we had the H3N2 virus. The influenza C usually causes mild illnesses, and the D, like I said, primarily affects animals like cattle and does not infect humans, which was interesting for me to learn this as well. Apparently the animals also catch the flu. I should have probably researched to find out if they're also treated with certain flu medications as well, but I didn't, so I'm not in a position to speak on that one. Our next respiratory illness, which is common around it's common generally speaking, but in North America and places that has 4 seasons with snow and what's not, I find pneumonia is always on the rise, as well as influenza during the cold and flu season. I've also experienced persons while I was overseas, there was a rise as well in pneumonia around flu season as well. Could you go up? I want to show, there's a slide with an X-ray depicting the infected lungs of a pneumonia patient as opposed to the normal lungs of the same patient. You could find that one? No, that's COPD. You're gone all the way down. You have to go up further. But while my technician looks for that slide, I'm going to have a short commercial break, and we'll be back to discuss more widely these most pressing matters. Thank you.
Get unbeatable value you'll love. Find it only at Quartz. We've got the best range in appliances, electronics, furniture, and so much more with the best quality and the best prices. Get a free gift with purchase on select items. Save 20% on select bases when you purchase the matching mattress. Take advantage of great deals and huge savings. Treat yourself. Keep your cash with Quartz Ready Finance. Unbeatable value only at Quartz. Bringing value home. Conditions apply. Offer ends February 28, 2026.
Yeah, man. Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
And welcome back, everyone. Sorry, I was just doing some readjustment of my screen in front of me here. So I think my technician was able to locate the slide I was trying to illustrate before the break. So yes, we are now moving on to pneumonia, which again, like I said, I find in the cold weather countries, pneumonia is also a part of the whole flu season, seasonal issues that usually happens around the winter months. This is an illustration of an infected lungs of a patient versus a normal lungs. As you can tell, the left side of the patient's lungs, that one is inflamed. You can see there is a lot of opacity. Sometimes too, what you'll find in pneumonia patients, sometimes they can also develop fluids in the alveoli. It's inflamed, the ear sacs are inflamed, and sometimes causing them to fill with fluid or pus, and which leads to coughing, fever, chills, and difficulty breathing. It's caused by bacteria or sometimes viruses or fungi. So unlike the flu, pneumonia can be bacterial, viral, or fungal. That is the interesting part, and I think a challenging aspect of pneumonia. It's not just a viral, or cannot just be assumed to be a viral issue. So for sure, in matters of suspected pneumonia, a sputum test, meaning the professional might ask you to swab the back of your throat, or sometimes, I don't think for pneumonia they will swab the back of your throat. They will ask you to cough, and they will collect some of your sputum to ascertain if it's, and they will send it to a lab to ascertain whether it's viral, bacterial, or fungal. We can move along to the other slide that kind of illustrates, yes, what happens to the alveoli when it comes to pneumonia, and how it affects the lungs and why it causes such an issue. The alveoli becomes inflamed, and there in this illustration you can see that there is fluid buildup within the alveoli, which causes respiratory distress in some patients, causing them to have difficulty with breathing. So the pneumonia, this infection is of the lungs, can be caused by, like I said, bacteria, viruses, or fungi. Symptoms often include cough, fever, chills, difficulty breathing, which can be diagnosed through chest x-rays and, like I said, sputum cultures. Let's move along in terms of prevention of pneumonia. Yes. Pneumonia vaccinations are available. Vaccinations against the most common bacterial pneumonia, the S. pneumoniae, helps to protect adults aged 65 and older. Those younger than 65, those older than the age of 65 are at an increased risk of pneumonia from developing this infection. These high-risk people include those with lung disease, like asthma, heart disease, liver disease, kidney disease, a cochlear implant, a damaged spleen or no spleen at all from whatever reason. Some persons may have had an illness or an injury and they have to remove their spleen for whatever reason. Certain types of cancers or undergoing cancer treatments can also make you susceptible to pneumonia. A weakened immune system. So all these predisposed issues can make you more susceptible to developing pneumonia. So we're going to move along to the other slide, which is chronic obstructive pulmonary disease. I'm not sure how prevalent that is in St. Kitts or if it's becoming prevalent at this moment, but in industrialized countries where persons where smoking, especially smoking of cigarettes and what's not, is a way of life and more of a cultural habit in those places. COPD is quite a chronic and prevalent issue that I came across. So it's a progressive disease. It includes emphysema and chronic bronchitis, categorized by persistent respiratory symptoms and airflow limitations. Symptoms include chronic cough, sputum production, and dyspnea. If we go down to the other slide, the right-hand side, you will see the effect of the COPD on the lung. It basically, even after a mortality for a patient that was suffering with COPD, even during an autopsy, what I found is the lungs, when you feel, if you try to touch the lungs, it's actually very spongy, like the disease, the morphology of the disease turns the lungs into like a spongy material. And so it's seen here in the illustration what really happens with the lungs. It fills the lung tissue and makes it that spongy, foamy consistency. So when the person tries to breathe, it's difficult for the lungs to contract as they should and to expand as they should. So it causes shortness of breath and dyspnea, sorry. So we're going to move along. Medications for COPD would include medications that are designed to relax the airway muscles, to reduce inflammation, and to manage exasperations. These include short-acting bronchodilators. These provide quick relief of breathlessness by relaxing the airway muscles. Inhale via inhalers or nebulizers and act within minutes. So for the normal onlooker or for the untrained eye, sometimes you might see someone using a nebulizer. And for us here as locals, a lot of asthma patients, they use nebulizers, but nebulizers are widely used for other illnesses, and this is a good example, COPD. So the long-acting bronchodilators used daily to prevent symptoms and reduce flare-ups. These effects last up to 24 hours. So these are the long-acting ones, whereas the shorter-acting ones, the half-life is not as long. So inhale the corticosteroids. That's another medication used to reduce airway inflammation and may be combined with bronchodilators to prevent exasperations as well. So oral medications such as theophylline, which can help to ease breathing and prevent symptoms from worsening. So through blood levels, this medication must be monitored due to potential side effects. The last but not least, common medication used to alleviate symptoms of COPD is the phosphodiesterase 4, the PDE4 inhibitors. The roflumilast can reduce inflammation in severe COPD patients. I can tell you, persons who have COPD, sometimes they have limited lifestyle mobility because of the shortness of breath aspect of the disease. Some persons find it hard to be active, and so it can be a very debilitating disease to have, especially in older people. And also, we use antibiotics during infections that can worsen the COPD symptoms as well. So it's a wide range of medications that a COPD patient might have to end up using so that their breathing can be sustained and to avoid death. Another common respiratory illness that I know, not just Caribbean and Kitishans, but studies show that many African Americans or many black people, they suffer from asthma a lot. So asthma is a chronic condition that causes inflammation and narrowing of the airways, leading to wheezing and shortness of breath, chest tightness, and coughing, especially at nights or early in the morning. I'm sure persons who have asthmatic children or asthmatic themselves can testify to these things when it comes to the morphology of the disease. At night, symptoms tend to seem to be much more worse than during the day, and so it's very possible for cold and flu symptoms to exacerbate or to make the asthma symptoms to flare up. I've seen that in many patients, especially children. So when it comes to obstruction of breathing, it's really important that parents know when to get to the emergency room if they don't have access to a nebulizer at home, or if the Ventolin or whatever asthma medication that's being issued is not working fast enough. It's really imperative that patients know when to take their children to the emergency room and to seek medical assistance before, I don't like to use the word die, but before things get out of control. So we're going to stick a pin here. We're going to take a short commercial break and pay some bills. We'll be right back.
There are some things in life that are worth the extra mile. Seize the moment. Capture the experience.
And welcome back. Thank you very much for tuning in. And those of you in radio, TV, or YouTube land, if you're just joining us, welcome. For those of us who have been here before, welcome back. I'm happy to have that. So we were discussing the effects of asthma during the cold and flu season for many patients, especially little children. I'm going to ask you to please let us see the next slide so I can illustrate what a normal airway looks like as opposed to what a pathological airway that is asthmatic. So the normal airway, as you can see, the passage is clear. It's not inflamed, it's not constricted in any way, and so in a normal airway, of course, persons should be able to breathe regularly without any issues. But as you can see, the asthmatic airway during an attack, as the asthma attack progresses, you will realize the constriction of the airways becomes more and more, how should I say, the constriction of the airways become more and more serious as the attack gets underway, and if the person is not medicated quickly or soon enough in time, well, we all know, like I said, I don't like using the D word, but if medication is not administered in quick time or in quick enough time, well, we know what can happen. So especially around this time of the year, in cold and flu season, when it comes to little children or the older folks, it's important to know when to take them to the emergency room if you realize they're having signs of distress when it comes to breathing. Just a minute. Yes, when it comes to breathing. We're going to move along. We're going to look at also tuberculosis. I must point out though, illnesses like pneumonia, COPD, asthma, and tuberculosis, all these are categorized as lower respiratory illnesses because of where it happens along the respiratory tract. And so the treatment, of course, is different than how you would treat a cold and flu, and sometimes the medications as well. I think sometimes most lower respiratory tract medications tend to be much stronger in nature. Sometimes they require steroids and that sort of thing. So for tuberculosis, we have it's a serious infectious disease that primarily affects the lungs, but can also affect other parts of the body. Symptoms include persistent cough, weight loss, and night sweats and fever. So it's important to note that a lot of these respiratory illnesses, they come with cough, some of them come with fevers, and some come with night sweats. So from the naked eye, sometimes all of the symptoms can look very similar in nature. So it's important that when you're feeling off, especially if the symptoms last more than a couple of days, for you to see your private practitioner. It's really important to establish the cause of breathing issues or airway constriction issues so that the problem can be fixed and dealt with as soon as possible. With tuberculosis, medications are very common, and in order for a diagnosis to be made as well, just as similar as the pneumonia, a sputum test to me is one of the, how should I say, one of the surest way to differentiate which virus or bacteria is which. And so once that is established, treatment becomes that much easier, and then we're not giving the wrong treatment for the wrong illness and vice versa and stuff like this. It's important that from the beginning the diagnosis is done systematically and done in a manner that is timely. Moving along, we have pulmonary embolism. I'm not sure how many persons have ever heard of a pulmonary embolism, but this condition is basically, it occurs when a blood clot, what we commonly call colloquially a blood clot, blocks a pulmonary artery, leading to sudden shortness of breath, chest pain, coughing, and coughing up blood. This is for sure a medical emergency. Sometimes, depending on where the blood clot occurs, I've known persons to mistake the type of pain for something else. So pulmonary embolisms are usually common in persons that suffer with clotting issues. Some persons may be put on blood thinners. I'm not sure. Before I did medical school, I've never seen a blood clot before, and so for me to conceptualize what a blood clot is, at the time I couldn't, but this illustration shows a very good example of what a blood clot and how a blood clot affects your arteries wherever it occurs. The blood clot is usually in the shape of wherever it occurs at that particular point in time. So I've seen some very, very massive blood clots that take the shape of the entire area where it's found when you try to pull it out of the artery. I can see why sometimes persons don't survive, because the clot is so massive. there was no way that the area would have been properly, how should I say, the clot wouldn't have been removed in time for the person to get to breathe. And so some persons actually lose their lives. It happens that way sometimes. So the treatment for pulmonary embolisms typically include anticoagulants, like I said, blood thinners. These medications help to prevent the clot from getting larger and reduce the risk of new clots from forming. Common examples include warfarin and heparin, of course. Fibrinolytic therapy as well is another treatment option. This involves medications that helps to dissolve the blood clots, but is less commonly used. For surgery or surgical procedures in severe cases, surgical intervention may be necessary to physically remove the clot from the area. Ongoing care, like regular follow-up and monitoring of the person's breathing, are essential to managing the condition and to preventing complications. So prompt treatment is crucial to prevent serious complications or death. Just 1 second. So I'm going to stick a pin in what we've been discussing. We're going to pay some bills and we'll be right back.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
Welcome back and good evening again, everyone in radio, TV, and YouTube land. Thank you for joining us. Welcome back again. I'm going to introduce to you our personality spotlight at this time. This is a lady that works at JNF. She's very near and dear to my heart. Just a second. I don't want to get her name incorrect at all. Anyhow, very near and dear to my heart. Her name, affectionately known as Tantan. Her office duties, her regular duties at JNF include she does janitorial services. I don't like calling persons maids. Her professional journey with JNF started more than 15 years ago. She has been with us for over 15 years, and she has given us stellar service. She's a very personable individual. She's very easy to work with. I personally love working with her. Never had a problem with her. She's always been very sunny, very happy, and a very, how should I say, a breath of sunshine sometimes when everything is going crazy in JNF. Like sometimes when everything is stressful, Tantan always has a smile. Her full name, her right name is Miss Tanisha Harrigan. It's my pleasure to introduce her as this week's Personality Spotlight. And she was very happy and willing to oblige. This is Miss Tanisha Harrigan.
Tanisha Harrigan is a member of the janitorial team at the Joseph Infants Hospital, and for the past 15 years, she has dedicated herself to keeping the hospital environment clean. On a daily basis, she is responsible for sanitation, sweeping, mopping of the wards, and the general maintenance of the restrooms. Tanisha usually rotates every few months to different areas within the hospital. Harrigan's colleagues describe her as very professional, dependable, and easy to get along with. We commended Tanisha Harrigan for 15 years of stellar service to the Joseph Infants Hospital on our HealthWise Personality Spotlight.
Thank you very much. That was my personality spotlight, Miss Tanisha Harrigan, affectionately known as Tantan. Tantan, we appreciate you, we love you, and we look forward for many more years of your dedicated service with us at JNF. Thank you again, Tanisha. So that brings me to the end, unfortunately, of this week's HealthWise. I'm sorry we couldn't have more material for our first episode, but I decided to keep it short and sweet because it's our first episode. I'm going to briefly go over our topic, which is the differentials for respiratory illnesses during cold and flu season in the upper and lower respiratory tract. So we have things like the common cold, the influenza virus, pharyngitis, sinusitis. I must say, I considered putting COVID on the list, but I didn't. Personally, I think COVID would have come under the lower respiratory tract as well as upper respiratory tract infection because of the way how COVID tends to operate. But I didn't. I left COVID out, but COVID really should have been included in respiratory tract illnesses. So we also have sore throats, nasal congestions, and fevers and coughs. The influenza virus is typically divided into three subtypes. You have type A, type B, and type C. Type D as well, which is commonly found in animals. We have pneumonia. This infects the lungs by bacteria, virus, or fungi. It typically affects very young children or adults over the age of 65, which gives difficulty breathing, fever, chills, and sometimes, in some instances, a lot of coughing. We have chronic obstructive pulmonary disease, or COPD. This is a progressive disease, includes emphysema and chronic bronchitis characterized by persistent respiratory symptoms and airflow limitations, chronic cough and sputum production, as well as dyspnea. The COPD lungs does not contract, or it does not contract and inflate the way it should. So therefore, there's where the difficulty in breathing will come in for the patient. So medications are geared towards relaxing the airways so that the movement or the motility of the lungs becomes more fluid, more easier to handle the breaths of the patient. Of course, everyone knows asthma, which is a fairly common respiratory tract illness here in St. Kitts. Tuberculosis, as well as pulmonary embolisms. So that brings me to the end of this week's HealthWise. I thank you very much for tuning in. It was a pleasure having you this evening, and I will see you guys next time for another informative HealthWise and health tips. Good evening.